Dr. Khetarpal, first of all, thank you so much for joining me for this particular conversation because this is something which has been uh, an area which has been ignored, not paid attention to, and doesn't come out in the forefront when we are having discussions around hospitals. Typically, it's the hospital owners and the doctors, but nobody talks about the administration part. And why I was looking forward to this conversation was because you are a doctor yourself and you moved consciously, voluntarily towards administration. And with so many years of experience with Rajiv Gandhi Institute as well as private institutions, I think you're the right person to answer my questions related to administration. What is the role of an administration in serving the core philosophy of building the bond between the patient and the doctor? Because at the end, that is what is visible outside. But how does administrative responsibilities add to this?
Thank you, Harbinder, for asking this question. It's a very valid question. See, my journey has also been from a clinical doctor to an administrator, and I have been into hospital administration for many years now. Well, the role of a hospital administrator to ensure that that the patient satisfaction level is at a very high level. That is the ultimate aim. So for this, it is he has a great role to play. An administrator has a great role to play. He has to keep the patient at the center always. See, when we say healthcare providers in an hospital, in an organization, it is from the CEO to the housekeeping staff. Everybody who is working in the hospital is a healthcare provider. He may be not dealing with the patient directly, so he may not come into contact with the patient, but still he is a healthcare provider, right? So whether you are dealing with the patient directly or indirectly, like doctors, nurses, technicians, they are in direct contact with the patient. But at the back end support staff, they are equally responsible to ensure that patients are satisfied. So administrator has to create an environment in the hospital that all stakeholders, right, in all at every level of employee, all categories of employee at every level should think of the patient first. So patient first approach and keeping patient at the center, right, is the first thing which, first of all, that administration has to always think of the patient,
Correct. Correct.
right? And of course, there are challenges dealing with different level of staff, people. Man management is something which is a big challenge for an administrator. He has to deal with a doctor, a very senior doctor, and they have their own issues, requirements, and every level of those employees. So if administrator, if he is very focused on patient care, he ensures that we are all here for the patient to ensure the patient safety and the quality of care. So this is one thing which has to start from the level of administration and keeping patient first in the mind.
Got it. And sir, this is very interesting because you said that it is sometimes very difficult to deal with the doctors and also keeping in mind the patients. Hospital I found is a very unique setup. Typically in an organization, the CEO calls the shots, right? But in a hospital, the chairman of each department knows what is the right thing that needs to be done, and the administration team and the professional CEOs, etc., who are not involved in the clinical delivery at that point in time as a doctor.
Nowadays, even the hospital owners, they are also quite aware that there is a lot of competition in the market,
Absolutely.
and yeah, if otherwise they will lag behind. So I would say that you will not be able to meet all the requirements of the doctors, but where the patient care is involved, and where even sometimes you may not be expecting an ROI in a expected time, but then still you will have to
So the cost
cost
benefit analysis
analyze cost benefit analysis
is done by
is
the
it is done. It is always done, and that is the role of the administrator to bridge the gap between the two.
sir. What has also been happening is that it's by nature the negative news spreads faster. Right? People, when they are happy with what is happening with their patient, they take it for granted. ये तो आपका काम है. लेकिन कुछ अनटूवर्ड इंसिडेंट हो गया, कुछ गलती हो गई, कुछ एरर हो जाता है. So that is blown out of proportion. And one spoken of not just media but today social media has become the mass media. Second is this has led to distrust in the healthcare delivery system, and that distrust is coming out by way of violence against doctors. Now, there was a time when doctors were treated as gods, life savers, life givers. To today, they are treated with distrust, and to the point that there have been incidences of physical violence in the hospital. How do you deal? How does an administrator deal with such kind of situations in the hospital?
Very relevant question. I am coming to the first part of your question, that the negative news, of course, they spread very fast, and today, social media is a very powerful tool,
Correct.
and this WhatsApp university and social media, we don't know what is true and what is not.
Correct.
So it is you know the responsibility of the hospital to ensure that, first of all, that they should ensure that from their side, uh, everyone, I mean all the doctors, and they are very much aligned with the mission and the goals of the objectives of the institution, right? Because every organization has set a vision and mission statement. So first of all they should be aligned with the vision and mission statement,
Correct.
with the objectives of the hospital. With keeping this in mind, uh, we should not do anything wrong. First of all, the inadvertent errors can happen. In the best of institution, best of accredited hospitals, errors do happen, right? No organization is error free. No organization is immune to the adverse events or errors. It is bound to happen. We are all human beings. It's a human to err. But then uh, we should not try to hide the error. We should try to have a proper reporting of the errors or incidents, and proper root cause analysis, and then take appropriate action, corrective action, so that the errors are not repeated. Or suppose if a small error has happened, if we do the proper analysis and corrective action is taken, then we will not, a small error cannot turn into a big error next time.
Correct.
So the transparency is very, not hiding the mistake, reporting, root cause analysis, and improving. So this is a continuous improvement process. So negative news, what we have to counter. If it is a negative news, we need to counter. It really spreads fast. But then it is also the responsibility of the hospital to highlight the good things which they are doing. Hospitals, they have done some very good, surgery, some very unusual case, successfully discharged, patient has gone back very happy. So they should also highlight the good things, right? So otherwise, the perception of the patients or the media or the public is, that doctors are, you know, they are sort of, they are looting, they are overcharging. But then it is also the responsibility of doctor to avoid how to avoid this. He should not be, he should communicate well with the patient. He should maintain proper documentation. Keep communication is a big gap actually. There is a lot of gap. When the doctor visits the patient in the room, he has to maintain an eye contact. He should see that he should speak to the patient. Studies have shown that 40 seconds of your intense interaction with the patient may be in stress. So that 40 seconds of intense interaction with the patient, talking to the patient, keeping hands on the patient's shoulder or on the patient's pulse, will reduce the stress level of the patient. The dopamine level will come down. So doctor has to ensure that. And he has to respect all the rights of the patient. Patient has certain rights, right? We have to respect the uh, dignity of the patient. We have to respect the privacy, confidentiality, proper consent has to be taken. Patient and family should be well informed, well educated about what is going on with the patient. Like most of the time, patient says that I don't know कि मेरे साथ क्या हो रहा है. There's nobody has
वो बता ही
explained
नहीं
me,
रहा कोई.
बता ही नहीं रहा. So I think these small measures. If the doctor is doing his job well, he's treating well. He may be a very good doctor, but if he's not, communicating with the patient, if his attitude, behavior, body language, is not appropriate or which is contradicting his, but he may be a very good, skilled doctor, but then there's no use of having, the core competency, your clinical competency, or you may be very credentialed, but then this empathy part, keeping an eye contact, talking to the patient, will reduce all these litigation. And of course violence against doctors is a this is also very common and these days. One of the reason is that it's a perception, patient perception also. We also think sometimes it's a thankless job. If you have treated the patient may not feel gratitude or not feel obliged, or just not give a thank you note to you. But then if something goes wrong, that will be highlighted. So I think the patient also needs to be educated. If once the patient is educated, if there is any delay in the service or patient is not happy, doctor should be able to convey to the patient. Once it is conveyed, so the patient satisfaction level will be maintained, and it is an era of patient delight, not only satisfaction, and patient experience, which will matter. So overall, if you see the whole ecosystem, it is the doctor-patient relationship, which is based on the trust and confidence, right? And this will come only when we have a rapport with each other and we communicate to each other. So
Absolutely.
yeah,
I think communication and
yeah, it's a very
misinformation or
misinformation thing.
misinterpretation of the communication, or because of lack of it, is one of the key challenges today. I think that's something that we need to take care of. And also, it's not that one day suddenly people start feeling that ये doctor खराब है. It is an accumulated effort
Yeah,
over
over
a
the
period
period
of
of time.
time.
Yeah.
आपने अभी errors की बात करी. Now, most of the time the errors may not be reported because doctor will feel or the team will feel कि यार I will be reprimanded for this error, and so they may not report it. They may not feel safe to report that is going to impact my career, etc. Whereas in healthcare, error reporting is paramount for making the treatment protocols better for tomorrow for everyone else. How can the administrator create a culture of making it a safe place to ensure there is complete transparency by a doctor by saying that, listen, we did this is an error that happened, and I want to report it so that tomorrow people are more careful when they are doing something like this. How do you ensure
Yeah, I
creating a
think
safe place?
it is important to create a safety culture in the hospital. It is all the a culture of an organization is very important, and culture has to come from the top. I mean, it is the commitment and the creating of the right culture, a safety culture, has to, the commitment has to come from a top management. Then only it will trickle down to all the levels of employees, and it is, when an error happens, we need to. The doctor should be. It's not only about the doctor. Error can happen. Medication error can happen. Error can happen from nursing, from a doctor, or from any employee. We should create a culture of reporting, which will, create a very transparent system that we want to improve. This will ensure that we really want to improve. Hiding the error or not reporting the error will, lead you nowhere. It will further worsen the situation. As I mentioned that reporting of error, sometimes some hospitals we should say that they are even rewarding the employee who is reporting the event. They are even appreciating. That culture has to be created. Okay, and it should not be a blame game, or it should not be like a punitive, action you should take. This error can happen, but then try to analyze the error and improve upon it. And otherwise, you know, error will keep on happening. So the role of administrator is very important, and proper system he has to create that reporting system. Proper robust documentation of the errors is very important. If once it is documented, errors are reported, then you will analyze, where you have gone wrong, you take corrective action, and then you improve. So it is very important that the role of administrator is to first educate the doctors and all the staff that please report the error. This is, any harm which has happened to the patient is, nobody, does any harm knowingly, or it's not intended harm. Hippocratic oath when we took, so it says that do no harm. The first thing, do no harm. So no doctor intentionally does any harm to the patient. But then if there is any harm which has happened by the doctor, or because of any failure in the hospital system, we need to, create a voice. We need to create a voice so that you improve, and the patient also should be informed. So that, the transparency has to be maintained.
This is very beautiful. But have you seen systems in Indian healthcare system right now where error reporting has been rewarded, and the doctor has not felt reprimanded for making a mistake?
See,
I mean,
first
is
of
it
all,
is
yeah.
it not reporting or holding information? Is it only in India, or this is something which is a worldwide
No,
phenomenon?
it's a worldwide phenomenon, and some of the best of the accredited hospitals, they even on their website they display that these many errors have happened and what corrective actions they have taken. So it's a very transparent system, and the idea is to not, as I mentioned, that it is not that we are trying to first of all you find out for the doctor's error, there is a system that we do the audit, some audit by the peer group. If the doctor has not followed the evidence-based medicine or the clinical pathways, so that audit system has to be there. And once the doctor knows that he is being audited or is being observed, so he will be cautious, and there will be less of errors. So error sometimes is not very obvious, but you have to find the error. So with the audit system,
You are able to
if you have a
detect.
proper medical audit or a clinical audit, so the hospitals, there are hospitals which have established system for the clinical audit. With that, whether we have gone wrong, we have deviated from treatment, So that system, if they are there, it will definitely, to cut down to, many of the errors. And as you mentioned that the, you know, rewarding the doctor, how do we reward a person who is reporting the error? Rewarding does not mean that you you can even appreciate a staff who has reported the error in front of everyone. You can say that, okay, because he or she has brought the error into notice of the management, we were able to improve. So that he or she will feel motivated. So motivation of the staff to report error and educating them that this is not a punitive or blame game, and this is to improve, continuous quality improvement. This will, because healthcare quality is a continuous journey.
Absolutely.
So that's why we say that errors should be reported.
पर आपने भी बात करी कि that is the reason that doctors have started going in for evidence based system, or in the audit they try to check whether uh, the evidence based medicine was given or not. Do you think this is creating a fear in the mind of a doctor, of डॉक्टर डर के काम कर रहा है, डर के करना चाहिए काम कि कोई गलती ना हो जाए, कुछ नहीं, बिकॉज यू आर डीलिंग विद लाइव्स ऑफ पेशेंट्स, बट लीगल इश्यूज के चक्कर में जब वो डर के काम करता है तो वो बहुत ज़्यादा फोकस कर रहा है ऑन एविडेंस, ट्राइंग टू फाइंड आउट, गेटिंग टेस्ट more than what is the minimum required, and that is adding discomfort in the mind of a patient कि यार ये डॉक्टर टेस्ट बड़े कराता है, जरूरत भी है कि नहीं है, and then the questions start coming out in their mind or taking birth in the mind of a patient that is he getting a commission from a this thing a lab or anything. How do you create, again my question, I'm going back to the same thing कि डॉक्टर बिना डरे they choose to do the right thing, which is as per the protocol, without fearing. Because
Yeah.
reality में, I mean, some of the things can look very beautiful on paper, but reality में अगर मेरा ये चीज़ बोली गई तो मेरी confidentiality रिपोर्ट के अंदर आ जाएगा, मेरा मेरा ग्रोथ नहीं होगा, लोग क्या कहेंगे, ऐसा होता है.
हाँ, देखिए, these are all ethical issues actually. When you mentioned that over prescribing, even under prescribing is unethical. Over prescribing is also unethical. So
Adding
it
cost
is,
also.
हाँ, but that's the reason. You also asked me about the violence against doctors. The perception of the patient is that suppose you miss a diagnosis, you have not uh, advised particular investigation, and then you miss a diagnosis. So that caused that litigation and that patient complaint. The doctor said, doctor, then that's why doctor is practicing defensive medicine.
Correct.
So he's trying to sometimes overdo and overprescribe. And I remember I'll give you one example. I was with Gangaram Hospital long back, and I was working in the emergency department. One of my colleagues, he had a patient who reported with headache, and he gave some preliminary aid to the patient, first aid, and discharged. Next day morning, patient landed in emergency again with severe headache. Then the CT scan was done, which revealed a brain hemorrhage. So the patient, attendant, family, sorry. So because he did not think that there's something of a very severe nature, this headache is a very vague complaint, and there was no associated symptoms. So he did not prescribe any high-end test or CT scan. But then next day morning, patient landed with acute headache, and the CT scan revealed the brain hemorrhage, and then the patient's family, they sued the doctor. Why we were sent back when we came yesterday without. So that is the reason. The doctors are also very overcautious sometimes, and they have a fear in mind. If I don't write this test, tomorrow if I miss anything, patient might sue me. Not only suing now, was it the violence is again one
I think it is
major
making a lot
factor.
of sense because हम लोग थोड़ा सा डॉक्टर के अगेंस्ट इसलिए हो जाते हैं कि 10 में एक में अगर निकला तो ये नो बोलते हैं कि आपने अननेसेसरी
And
क्यों सीटी स्कैन क्यों कराया बट फ्रॉम द डॉक्टर्स पर्सपेक्टिव it is to ensure that that one case does not get missed, right?
absolutely,
So I
absolutely.
think that's a very beautiful thing. Dr. Khetarpal, my last question to you. With your years of experience as a doctor, practicing clinician, then in the administration side, and then now you've been associated with the AHPI for a very, very long time. So you are understanding the hospital from the outside perspective, focused on quality, patient safety, standards, etc. What do you think are the two or three things that administrators can do to make a difference going forward in the future? Because now we have technology available, AI is there, so
Hmm.
the AI, apart from assisting the doctor, can also uh, assist in helping and understanding that what human could have missed. So doctor is told that, listen, have you tested this, have you checked this, do you check this, so the errors have reduced. So what do you think are the two or three decisions that administrators like yourself could make to improve the health hospital going forward?
Yeah, see, first of all, going forward, we need to adopt technology, right? And it is not that you know, otherwise your knowledge or the skill which you have, you will become redundant. So, to looking at the future and of the of the hospitals should ensure that the latest technology is adopted. Of course, technology also has a cost, but AI is something which is playing which is a buzzword now, and AI in healthcare and artificial intelligence is a great tool actually, and it has a great role to play right from the preventive to diagnostic to treatment, curative, and to all spectrum of care. So it's an era of preventive and predictive medicine.
Correct.
AI can even predict the disease, and precision medicine is again one thing once it is diagnosed. So AI has a big role to play, but we should not be dependent on AI, on technology. As I mentioned previously, also it is the human touch which matters, and because if anything goes wrong with the patient, if you are too much of AI dependent, it is not the AI which will be morally, legally, or ethically responsible. It will be the onus will lie on the doctor who is treating the patient. He is responsible ethically, legally, and morally. If anything goes wrong with the patient and he's too much dependent on AI, so he has to use his own brain. See, AI is nothing. AI actually is it is artificial intelligence. Your original intelligence, which you have fed to AI, you are only training the
Correct.
AI. It's all data based. So whatever data you feed, AI will reveal that in a. It will give you a very fantastic, result. What you have fed. But then sometime AI also can go wrong. So we should not be too much. We should embrace AI technology, but not let the AI, dominate you.
Correct.
And that human touch, that empathy, and your personal bond with the patient, AI cannot replace that. So the one thing is, of course, the technology embracement is important, and then uh, uh, keeping, this is a competitive world, and if you don't, match the requirements of the patient, you will lag behind. So we need to uh, try to fulfill the requirements of the patients and see that ultimately we are whatever care which we are giving to the patient is a holistic care. It is not like your approach is very casual, and you have to think the patient in totality. You have to treat the patient not as a commodity or not as a focus for one particular disease. So patient may have so many conditions, comorbid conditions. So it is like you need to totally get involved. But lastly, I would also say that patient empowerment and involving patient in the care decision which a doctor is taking is very important. You have to give options to the patient, and it is not like you dictate a treatment to the patient, and there are options available. So patient should be involved, patient should be engaged, patient should be empowered. So if you keep all this in mind, you know you'll be a long-term player in healthcare. So future is adopting the technology and empowering patients, engaging patients, involving patients, and see that uh, taking the next step is to see that it is we work in a very collaborative world. We can't work in silo. So and we need to healthcare has different domains. So many sectors are there. So we have to work collaboratively, and with this, I think you can achieve your goal and really what you want to achieve.
Fantastic. In fact, what I hear is that one, adopt technology, but technology, when it comes to AI, it is not replacing the human brain, but it
Yeah.
is using as something that can actually augment, support, and help you take better decisions, help you not miss out what otherwise is not meeting the human eye. Uh, the other two words that I really caught on when you were speaking was that today is an era of customer delight. So in our case, when it comes to healthcare, it is the patient delight. So basics, anyways, you are supposed to do, but if you can do beyond that, then you are talking about patient experience. And the technology is something that I think it's a no-brainer that we need to embrace, but embrace as a something that can help you do better, but it does not replace the human brain. Dr. Khetarpal, thank you so much for speaking today, and
Thank you,
it's a
Arbinder.
pleasure.
Thank you so much.